Tired? Again? Let me guess. You got 8 hours of sleep, had your morning coffee, and you're still dragging yourself through the day like a zombie auditioning for a low budget horror film? Well, you're not alone. In fact, fatigue is one of the most common complaints doctors hear. Right after I Googled my symptoms, and now I think I'm dying. Welcome back to DocDecoded, the channel where we break down health topics without putting you to sleep. Unless that's what you need. Today's topic: fatigue. Why you're always tired, what's normal, what's not, and how to stop feeling like a deflated balloon. Now tell me in the comments. On a scale of 1 to 10, I need a nap right now. How tired are you today? Let's dive in. What is fatigue really? Fatigue isn't just feeling sleepy. It's a whole body sensation of low energy, reduced motivation, and zero desire to do anything. Even binge watch Netflix refers to the subjective experience of physical and mental weariness, sluggishness, and exhaustion. And it's different from drowsiness, which is that irresistible urge to fall asleep. Like in a post-lunch Zoom meeting, fatigue is one of the most common symptoms in clinical medicine. Here's the kicker. Fatigue is a prominent manifestation of a number of systemic, neurologic, and psychiatric syndromes. Thus, fatigue can be physical, like sore muscles and low stamina, or mental, like brain fog, poor concentration, and the inability to finish a sentence without forgetting what you were saying. Wait, what was I saying? In the context of clinical medicine, fatigue is most practically defined as difficulty initiating or maintaining voluntary mental or physical activity. In surveys, more than 1 in 5 people report feeling fatigued most days of the week. In primary care clinics in Europe and the United States, between 10 to 25% of patients surveyed endorsed symptoms of prolonged or chronic fatigue. But only a minority was fatigue, the primary reason for seeking medical attention. Fatigue is considered prolonged when symptoms sustain for more than 1 month, and chronic when it is longer than for a duration more than 6 months. In a community survey of women in India, 12% reported chronic fatigue. Nearly everyone who has ever been ill with self-limited infection has experienced this near universal symptom, but usually brought to medical attention only when it is either of unclear cause, fail to remit, or severity is out of proportion with what would be expected for associated trigger. That's basically an entire population running on low battery mode. What do you think is the number one cause of fatigue? Drop your guess in the comments before I spill the beans. Common causes of fatigue. Let's break this down. Here are the top 5 culprits behind fatigue. And no, it's not just your annoying boss. Poor sleep quality. You might be in bed for 8 hours, but are you tossing and turning, scrolling TikTok till 2 a.m. or snoring like a chainsaw? That's not quality sleep. Nutritional deficiencies. Low iron, low B12, low vitamin D. These can all suck the life out of you. Your body is basically saying, hey, I'm trying to function here, throw me a nutrient or two. Weird, but true. Did you know that iron deficiency can sometimes cause cravings for ice, dirt, or clay? This is called pica. If you've been chewing on ice cubes all day, your body might be sending you an SOS. Dehydration. Even mild dehydration can make you feel sluggish. Your body is 60% water, not 60% coffee, as many people believe. Don't think that if you're taking many cups of coffee and tea, you are fulfilling your body's required water. No, water means water, no replacement. Sedentary lifestyle. Ironically, the less you move, the more tired you feel. Exercise actually boosts energy, even though just thinking about working out is exhausting. Stress and mental health. Chronic stress, anxiety can hijack your energy. Your brain's like, we're in survival mode, buddy. No energy for anything else. Think. Which of these sounds like it could be your reason for fatigue? Be honest. No judgment here. You can write in the comment section. We can have a solution for it. Now, sometimes fatigue isn't just about lifestyle. It could be a symptom of an underlying condition. Possible medical causes. Anemia. Chronic or progressive anemia may present with fatigue, sometimes in association with breathlessness and high pulse rate. Low serum ferritin in absence of anemia may also cause fatigue that is reversible with iron replacement. Thyroid problems, especially when there is decreased release of thyroid hormone, medically called as hypothyroidism, where you may have other associated symptoms of hair loss, dry skin, cold intolerance, constipation, and weight gain. Diabetes. Both decrease or increase sugar level can cause lethargy in type 2 diabetes. Mellitus and fatigue is associated independent of glucose level in type 1 diabetes. Adrenal gland insufficiency can also manifest with an explained fatigue as a primary symptom, along with the loss of appetite, weight loss, hyperpigmentation, etc., etc. Sleep disorder. Fatigue is also a frequent consequence of traumatic brain injury, often occurring in association with depression and sleep disorders like obstructive sleep apnea, particularly in those with prominent snoring, obesity, etc. Obesity is associated with fatigue and sleepiness, likely contributed by physical inactivity, diabetes, and depression. Obese patients undergoing bariatric surgery experience improvement in daytime sleepiness. Heart and lung-related diseases. Fatigue is one of the most taxing symptoms reported by patients with congestive heart failure and chronic obstructive pulmonary disease and negatively affects quality of life. Psychiatric disease. Fatigue is a common somatic manifestation of major psychiatric syndrome, including depression, anxiety, etc. Psychiatric symptoms are reported in more than 3 or 4 of the patients with unexplained chronic fatigue. Neurological disease. Fatigability of muscle power is a cardinal manifestation of some neuromuscular disorder such as myasthenia gravis, multiple sclerosis, Parkinson's disease, stroke. Episodic fatigue can be a premonitory symptom of migraine. Both liver failure and chronic kidney disease can cause fatigue. 80% of hemodialysis patients complain of fatigue, often associated with anemia and nutritional reasons. Malignancy or cancer. Fatigue, particularly in association with unexplained weight loss, can be a sign of occult malignancy. Malnutrition. Nutritional status may also be an important commodity and contributed to fatigue in other chronic illnesses. Observe if you are losing muscle mass. Infections. Both acute and chronic infections commonly lead to fatigue as part of the broader infectious syndrome, especially viral infections, tuberculosis, HIV, chronic hepatitis, endocarditis, etc. Immune-mediated diseases like SLE, rheumatoid arthritis, inflammatory bowel disease, vasculitis is often associated with fatigue, however, usually not an isolated symptom. Chronic fatigue syndrome. It is a completely different spectrum of syndrome of variety, but unclear etiology. We can discuss this separately. Drugs. Many medications like antidepressants, antipsychotic, anxiolytics, anti-seizure agents, drug withdrawal or alcohol overuse can lead to fatigue. Pregnancy. Fatigue is very commonly reported in women during all stages of pregnancy and postpartum. And of course, long COVID is now a well-documented cause of prolonged fatigue. So when should you worry? Here are some red flags. Fatigue that lasts more than 2 weeks with no improvement, weight loss, or gain without explanation. Shortness of breath or chest pain. Mood changes or memory issues. Feeling cold all the time or hair thinning. If your tiredness makes you consider moving your bed into your workplace, it's probably time to see a doctor. Would you want a video explaining chronic fatigue syndrome in simple terms? If yes, type "yes please" below. Quick fixes that don't work. Let's talk about what doesn't work, but people do anyway. More caffeine. You chug another coffee at 4 p.m. You feel better until 3 a.m. when you're staring at the ceiling wondering what life means. Energy drinks. These are basically liquid chaos, sugar, caffeine, and regret in a can. Pushing through, ignoring fatigue, and pushing through with brute force. That's like driving a car with the check engine light on. Eventually, it will stop, dramatically. What's your guilty tired day habit? A. Coffee overload. B. Doom scrolling. Sa. Cancelling plans. D. All of the above, tell me in the comments. Real strategies that help. Let's fix the fatigue. For real this time. Prioritize sleep hygiene. Go to bed and wake up at the same time. No screens an hour before bed. Make your room cool, dark, and quiet. Say no to late night pizza. Hard, I know. Hydrate smartly. Start your morning with a glass of water, not coffee. Hydration first, stimulation later. There is no replacement of water. Eat like you love yourself. Focus on iron-rich foods. Spinach, lentils, red meat. B12, eggs, dairy, and whole grains. Cut down on sugar spikes. Your energy is not a roller coaster. Move your body. A 20-minute walk daily can change your energy game. You don't have to run marathons. Just move. Check your mind. Don't underestimate stress. Try mindfulness, therapy, journaling, or just yelling into a pillow. It works. Trust me. An interesting tip for you. Studies show that nature exposure, even just looking at trees, can reduce fatigue and improve focus. Time to take a walk outside. There is no specific diagnostic test to evaluate your fatigue syndrome as a whole. When you approach your doctor for evaluation, he or she may suggest you a certain test for investigations to rule out the above cause and treat accordingly. Therefore, you should listen to your body and its signals to approach your doctor on time rather than getting delayed for diagnosis. There is no treatment specific to fatigue. If the diagnosed cause is treated, the symptoms of fatigue get relieved. Therefore, you can try the above measures before approaching the doctor. However, if not relieved, please do not delay to rule out other causes. Unfortunately, in many chronic illnesses, fatigue may be refractory to the traditional disease-modifying therapies. If there is no underlying disease diagnosed, antidepressants may be prescribed when symptoms of depression are present. Cognitive behavioral therapy has been demonstrated to be helpful in cancer-associated fatigue. Reports state that combination of both cognitive behavioral therapy and graded exercise therapy also modestly improve the unclear fatigue syndrome than standard medical care. As an annual health checkup, you can have some screening tests like CBC, HB, TSH, vitamin B12, vitamin D, FBs, PP, lipid profile, S-creatine, ECG to save yourself from common causes. So the next time you're wondering, why am I always so tired? Remember, your body's probably whispering a message. Don't ignore it, decode it. If you learned something today, hit that like button, subscribe to DocDecoded, and share this video with your sleep-deprived friends. And now, tell me in the comments, what topic should we decode next? Sleep apnea, iron deficiency, morning routine for energy, or something else entirely? Drop your suggestions below and let's make health simple together. Until next time, rest well, hydrate, and stay curious.